Meantime, NBC has now learned Elon Musk has officially joined the administration as a special government employee. Joining us now is former assistant administrator for global health at USAID and New Yorker staff writer, Dr. Atul Gawande. Thanks so much for being here. What do you make of what's happening at your former agency? And do you think it can survive this moment now that it's been folded into the State Department?
I'm seeing it up close. I'm a surgeon who ran it for the last 3 years, ran the global health operations there. It's not a overhaul, it's a destruction that's going on. And it's at the hands of someone who has not a single layer of accountability or oversight in the work being done. What we're seeing is first something that started with a, quote, pause in all funding. That stopped all activities. As a surgeon, I can tell you, you can't stop an operation halfway through and say, I'll be back in 90 days. And that's precisely what's happened to programs that are dispensing HIV medications that keep 20 million people alive around the world, that are stop surveilling bird flu in 49 countries, a disease that has reached our shores and killed an American on home soil. All of this has tremendous harm, and it's clear that it's either ignorance or indifference that's leading Musk and his team to take actions dismantling it all. We're talking about organizations like Catholic Relief Services and Save the Children.
Yeah, let's talk more about some of that in a moment, but I do want you to hear what we are hearing from those on the inside right now. These are USAID workers who are just outside headquarters yesterday. Listen to what they told us.
I watched people get put on administrative leave or fired, and I was just sobbing in the hallways. People getting fired, people getting furloughed in droves, like the entire development community being brought to its knees. And inside the walls, nobody feels safe. No one informed me that that was going to happen. No one has informed me about, plans for what's happening next. And, every day has just been like, what is going to happen today? And then it just hits. And I've never felt so disempowered or disrespected as I have in the past 12 days in the walls of somewhere that I love so much.
Doctor, the Trump administration has suggested mismanagement is to blame for what's happening and that taxpayers need to know how their money is being spent. USAID accounted for about 1% of the total federal budget in 2023. Why do you think Trump and Musk have landed on this agency as part of their big show of cost-cutting measures?
It was one of the easiest places they could instill chaos and fear. Understand, it was not only then a freeze, but then a decapitation of the top leadership in the Global Health Bureau, for example. In addition, there was half of the staff terminated. And part of the reason that USAID is such a target is because the civil servants who have protection are a minority of the staffing. Many have been put on administrative leave, but haven't been terminated because they can't without cause. On the other hand, the others are contract workers, people who work with contractors, and those are our top experts. We're talking about 2/3 of the malaria staff let go, of whom includes one of the top global experts in the world in the field. How does that make U.S. stronger? How does that make us safer?
So you point out some important examples to highlight. The White House has a list of their own examples of what they're calling waste and abuse. At USAID, one program they mention is a $2.5 million project for electric vehicles in Vietnam. Several of these other examples that they cite involve LGBTQ initiatives or promoting contraceptives in various countries. They call this waste and abuse. Is it?
Well, first of all, there's a debate over programs like that are serving diversity or advancing climate. You don't stop the entire activities of a multi-billion-dollar organization because of a $1 million policy dispute. Every president comes in and puts in new policy initiatives, changes the tenor. We can have those arguments, but this is a constitutional issue. Congress appropriated funds and directs what the programs are. A billionaire, the richest man in the world, does not get to dictate, especially when they don't even have any knowledge of the harm that's happening. And then programs that Save the Children, Catholic Relief Services, and others are moving out in the world that are reaching hundreds of millions of people whose lives are deeply affected. That disaster relief is happening around the world, addressing refugee needs. These programs have ground to a halt, and you see enormous suffering now as a consequence.
Dr. Atul Gawande, thank you so much for joining us. Appreciate the conversation.